Good evening, everyone, and welcome to our series this evening, Prescribing Positivity. This is a series where the Office of Health Ministry of the AMEZTV Church invites members of different health specialties, whether it is physical health, mental health, all of those specialties, to join us and really just share your expertise with our congregation, with our communities. And for those of you who are joining us tonight, as you listen to this conversation, please type in your questions. We'll address them as we go throughout the conversation. And remember to share this interview with others. Tonight's presentation is about understanding insurance options, especially for our older adults, when we talk about Medicare and Medicaid. We'll also be talking about things such as a living will. What does that mean? Estate planning. What do you need to have in place? So we've compiled excellent group of experts this evening. We want to thank Brother Darren Kent for hosting us. And we're excited to introduce our panelists this evening. So I'm going to start in alphabetical order, and we'll start with Miss Judith Bentley. Miss Judith Bentley is the founder and CEO of Our Pearls. Is an organization that's dedicated to making sure that seniors and other eligible individuals get the benefits they've earned, that they've worked for and are eligible for. Pearl stands for people, E for our elderly, our aging, our retired, our loyals, our seniors. And her mission is to educate each person that God places in her path about the benefits they're eligible for and to make sure that they're connected to those benefits. She's going to tell you about what is her why and what is her who when she comes onto the stage later. The next person that you will be hearing from this evening is Dr. Kimberly Clark. She is a community-based pharmacy resident at New Vance Health at the Arnold and Marie Schwartz College of Pharmacy, Long Island University, Brooklyn, New York, and currently doing her pharmacy residency program. She's driven by her dedication to serving the community. She's very enthusiastic about engaging in opportunities that directly enhance the lives of others, whether through providing support or resources. Next, we have Mr. Artie Kilgore, a financial advisor with Kilgore Financial Services. He has attended Livingstone College in North Carolina. Many of you are probably familiar, and also has attained several certifications at the American College of Financial Services, Liberty University, National Tax Training School, and the Carolina Insurance School based in Charlotte, North Carolina. So we welcome him as well. Last but not least, we have Michelle Mills, who is our certified senior advisor, owner of M. Mills Insurance Group, which is an insurance agency offering Medicare plans in 31 states, including North and South Carolina. She believes in building trust and providing education with dignity and respect. And the insurance group is committed to guiding clients down a path to a future that's filled with satisfaction, better health, wealth, and a retirement filled with promise and enjoyment. She's also a certified senior advisor as well as an outreach specialist, thriving on connecting seniors with vital community resources. So I want to welcome everyone to the stage. How's everyone doing? Wonderful. So the way we'll move through our conversation tonight, we're going to start with just the basics, understanding Medicaid and Medicare. And what really intrigued me about this conversation, I wanted to bring this to the rest of you who are listening, is a personal story. Both my parents, between, I would say, 2015 and 2018, both came down with chronic illnesses, which were life threatening, but also involved us having to change insurance plans. And they were both over the age of 65 at the time. And so, even being a physician, it was still a very confusing process, very daunting process. I had to get the help of insurance agents such as Judith Bentley and Miss Mills, people with that expertise to help me weave through what does this all mean? How do I make sure that they still get the care they need? So it was really, really, really important that we sought that expertise, and I'm hoping that you will gain something from tonight's conversation that would help those in your home or in your community who are older adults. You can refer them to some of this information. And also, talking about living wills, what does that mean? What does it mean to have an advance directive? And it's okay to start having those conversations. So we'll start tonight's conversation with Dr. Kimberly Clark, and she's going to be sharing some information about understanding Medicare. So if you could cue up her slides, she has just a few slides. Thank you so much. So Dr. Clark, it's all yours.
Thank you for the introduction. So we'll just cover a few slides that will essentially help us differentiate between Medicare and Medicaid. So Medicaid and Medicare are two different programs, but they are both separate government-operated programs that will help provide medical and other health-related services to separate groups of people. So Medicaid is a state-run program that provides hospital and medical coverage for those with a lower level of income. Medicaid can either be full coverage or supplemental, in which case it will pay for services after Medicare. Some individuals may qualify for both, and that will be considered dually eligible. Dual eligible enrollees will receive health coverage from both federal, which is your Medicare coverage, and state, which is Medicaid. So individuals who are dually eligible for Medicaid and Medicare typically start out as eligible for one of the two programs and then obtain eligibility for the other program later on. For example, Medicaid enrollees may turn 65 years old and then become eligible for Medicare. However, dually eligible enrollees become eligible for Medicaid under various pathways, some of which are mandatory for certain states and others that are optional. However, each will have its own rules about who's eligible and what Medicaid will cover. On the other hand, Medicare is a federal health insurance program for those people aged 65 and older. People older than 65 with certain disabilities or permanent kidney failure, or those requiring kidney transplant or amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease, can also qualify for Medicare. So essentially, Medicare can be broken down into four main categories. That will be Medicare Part A, Medicare Part B, Medicare Part C, and Part D. And Medicare Part A and B is also known as the original Medicare coverage plan. However, before we dive into what the different categories entail, it is important to keep in mind that Medicare does not pay for all healthcare costs, but it does help pay for some costs. Medicare doesn't include coverage for all medical expenses or costs of most long-term care, but it's important to keep in mind that you do have choices for how you get Medicare coverage. So Medicare Part A, also known as your hospital insurance, will primarily cover hospital visits, of course, skilled nursing facilities, hospice care, and some home health care services. Medicare Part B, also known as your medical insurance plan, will cover medically necessary services such as primary care visits, clinic visits, vaccines, lab tests, surgery, medical equipment, preventative exams. This can also entail disease screening and some outpatient and home health care services as well. Medicare Part D plan is also known as the prescription drug coverage plan. And each Part D plan covers medications differently. So this is very unique to you. So your most affordable drug plan will be unique, and then the plan may be different than the plan that's best for either your spouse or your friend. However, there are multiple resources that are available to help you determine what's the most cost-effective drug plan that is available. Next, we have...
Go right ahead.
Oh, yes, sir. Next, we have our Medicare Part C, which is the Medicare Advantage plan. So if you choose to enroll in a Medicare Advantage plan, you can also buy a Medicare approved plan from a private company that will bundle Medicare Part A, Part B, and sometimes Part D into one plan, as well as additional benefits that will include vision, hearing, and dental altogether. So with this managed care plan, also known as Part C, so with this plan, it administers the healthcare treatment of the enrollee utilizing a physician, also known as the gatekeeper. And this physician will approve you for referral to specialized services, essentially meaning that you'll only be required to use doctors or hospitals within that specified network. So, for example, if you need a referral to see a specialist, that will only be done with through the referral of your doctor or only utilizing those facilities or suppliers that belong to that specified plan.
Wonderful. Thank you, Dr. Clark. Great overview there. And I know our insurance specialist will give us, additional information as well. But thank you for sharing that overview, the differences between Medicaid and Medicare. And we'll come back to you at the end as well to see if there are other tips. But we'll move on now to Miss Mills, and just wanting to understand a little bit more about the insurance plan. So we talked about the Medicare options.
Mm-hmm.
How do I even know where to begin when choosing Medicare options?
Well, I would say one of the first things is to find a trusted agent or person that you trust. And you also want to consider things like the cost of your plans when you are searching for one, like premiums, copays, coinsurances. You also want to make sure that it fits your budget and your needs. Okay. And then also, you want to make sure that your primary care doctor, actually all of your doctors, are a part of your network, depending on what plans you choose. Because if you go out of network, then your costs rise sometimes significantly out of network. You also want to make sure, look at their star ratings. Okay, look at the plan star ratings, and I'm specifically talking about Medicare Advantage plans. And you want to choose a plan that is at least 3.5 or more stars. Okay. Now, those are actually based on feedback from customers or plan enrollees. So that's where the star ratings come in. Also, you want to see if your plan offers extras like dental, vision, hearing, and all of those extras that come with some Medicare Advantage plans. And also, you want to know if they have like transportation, because transportation is a huge issue for many, many seniors. You want to know if they have transportation. And also, you want to make sure that you stay in a network depending on what type of plan you have, because, like I said earlier, your costs will increase sometimes significantly. Also, you want to know whether the plans cover if you have special needs such as diabetes, if you are dual eligible, you want to look for plans like that. But the most important thing is to find a trusted advisor, in my opinion. Okay. Now, if you're new to Medicare, okay, it's very important that you start to look early. I know I run into people who have started looking a year early, but at least 6 months, because you want to look early and see, make sure that you include Medicare supplements in that, because that may be the best plan for you, not just a Medicare Advantage plan. Okay. So you want to start to look early. And also, if you or your spouse are already on Social Security, of course, you will be automatically enrolled into Medicare Part A, but then, of course, Part B, you would need to apply. You can go to the Social Security office, go to ssa.gov, and get all of that taken care of to get enrolled.
That is some great information. And overall, again, like you said, get an agent, start early. It can take months, starting. You gave us some really
A
good information.
trusted agent.
A trusted agent,
Trusted
exactly.
agent.
Exactly. Miss
Mhm.
Bentley, you were going to say something?
I was agreeing with her. It is very important that it's a trusted agent because not all agents are alike.
So
Exactly.
true. So true. Mhm.
Is any other step that we should be considering? We talked about the first, second steps, starting early, finding that trusted agent. What else
Mhm.
do you do if you're advising, and this is for either of you, or for
Okay.
both of you to answer? Mhm.
So, when someone is about to turn 65, they actually have a 6 month period before the month they turn 65 to get a Medicare supplement. And then, of course, they have their initial enrollment periods. So, you have to be very careful. Also, I always advise my clients, whether you take medications or not, please find yourself a plan because down the road you may be penalized. And that goes for Part B as well. Okay, so if someone has an employer plan, they have special enrollments as well. And I'm sure Judith can add more to what I've said, and even Artie.
Absolutely. So one of the things that I just wanted to follow on and tag on with to Miss Mills, she mentioned about the Part B and getting enrolled promptly so that you don't get penalties
Right.
added to you for a lifetime, right?
Exactly.
So
Exactly.
I know that a lot of individuals aren't quite sure when they need to start the process. So the process would start about 3 months before the month of
Mhm.
your your birth, and then 3 months after. So you have that 6 months period in which to get a plan. And once you get that plan, or once you get become eligible for Medicare and you get your parts A and your part B, then you can go ahead and join an advantage plan. What the thing most people will take a look at sometimes, once they get that red, white, and blue card, they think that that's it. And like Miss Mills said, if you do not take medication, and I know a lot of my clients say, well, why do I have to get a plan if I don't have any medication that I'm taking? It's just like an insurance plan. You get an insurance or car insurance, you get a car insurance plan so that if you have an accident, then you have it. The thought process with Medicare is that as you get older, you're likely to become more sick or ill or having some types of chronic diseases. So it's better to have medication ready so that if you run into that situation, if your health declines, then it's there for you. If you don't have it at that point, when your health declines, then it becomes a little bit more difficult to get medication based on what your chronic is.
Okay. So then should everyone really then get a Medicare Advantage plan, the C, where you have A, B, and D? Or what do you both think?
Okay, some individuals, like I said, you have original Medicare, which is just your red, white, and blue card. Then you have the Advantage plans, and then you have what is called supplemental plans. Now, the difference between all of those three, with the original Medicare plan, you would have to be responsible for the 20% that Medicare does not take care of. So you have, let's just say you have a bill that is $10,000, right? And Medicare will pay $8,000 of that. And if you don't have a advantage plan or a supplemental plan, then you have to come out of pocket to pay the extra 20%. And most people don't really have that. One of the biggest things that happens with individuals, especially that are seniors, it becomes very difficult for them to take care of themselves based on health expenses. So when you have a advantage plan, which is the C plan that Michelle spoke of, or a supplemental plan, then that will help you to take care of or pay for that extra 20% that Medicare doesn't pay for. The advantage plan is A, B, and D all together, like Dr. Clark mentioned before. It is taking the original Medicare plan and porting it into a carrier plan, such as a United Healthcare or Humana, one of those plans. And it's also giving you the benefit of the D plan, which is your medication plan, and it ports all of those benefits into one single plan. And that's the advantage.
Thank you. Thank you for that. And Ms. Mills, Ms. Bentley talked about the Advantage plans and so forth. What about, don't you have to pay monthly premiums for some of those plans?
Well, they actually vary by carrier. Some have zero premiums, and some have small premiums. Some have larger premiums. Also, I'd like to point out too that there are standalone drug plans should someone not choose a Medicare Advantage plan, and those definitely have premiums, and some of them for 2025 are quite expensive.
Yeah.
Quite expensive.
Okay.
Okay.
That brings us, Ms. Bentley, then to the next question. So everyone's, starting to probably get packages in the mail because open enrollment is coming soon. Could you tell us what those dates are that they need to remember for open enrollment, and what are the changes for this upcoming year?
Okay. So the dates is going to be October 15th, which is the start date. So if you have an individual that is Medicare eligible, or they have a plan, and someone comes to you and says, let's enroll you now today before October 15th, that is a violation. So you can't do that. You have to wait for October 15th, the day of, and then the last date to enroll is December 7th. So you have that 7-week period of time where individuals would either, if you're turning 65, like Michelle mentioned, then you're just going to get a new plan. If you're already on a plan and you decide, you know what, I don't think I like this plan, or I didn't like this plan, or I've heard about a bigger benefit, something else that is more that I'm interested in, let me look at that plan. That's the point in time. This period is where you get to change your plan from what you had before to what you really want for 2025. The changes that comes in for 2025 is driven mostly, I say mostly because the amount of changes is driven by the IRA rule that came in that impacts the medication of the seniors, where now instead of the seniors having to be responsible for medications that goes up to $3, $4, $5, $6,000, it is capped at $2,000. And after they reach $2,000 that they've paid out of their pockets, then the company will absorb the rest of the benefits or the rest of the expenses based on medication. So there's a lot of changes that is coming for 2025 for all of the plans, some more than others, and it is mostly driven by that. However, every year, each carrier will make different changes, tweaks to their plans, giving you something a little bit more, taking away something here and there, so that you can have different plans as you go on yearly. My advice to everybody is never just be one and done. Always look at what the changes are going to be, whether or not your benefits for next year, because something might come up, or something might be included in the plan that you have this year that might not be included in the plan for next year. So you always want to make sure you do a comparison to be sure that you're getting everything that you want.
Okay, so even if you want to stick with the same plan, it's still important to see if there were any changes.
Absolutely.
Okay.
Absolutely.
Yeah,
And
they only guarantee like 12 months anyway. So you might as well look and see what's available and what will work better for you.
okay,
Absolutely.
okay. And Ms. Mills, we're older adults will be bombarded with a lot of mail, a lot of stuff coming in, a lot of phone calls. How can they detect and avoid scams?
Oh, wow. I'll tell you, I am so passionate about that, I do free classes to different senior housing. So I am just very passionate about it. And we always learn a lot. So basically, one of the first things since the beginning of the pandemic, scams have reached $5 billion. Not million, billion. Okay. So seniors have lost a lot of money, and it's due to, isolation. They weren't around anybody, nobody to stop them. And so scams have just become outrageous and so plentiful now that there are just scams everywhere. But a lot of times during the annual enrollment period, they get inundated with calls. And these people can be very, very convincing. Okay. And also, they can also be non-compliant by enrolling them into plans they never agreed to enroll in. So it's so important because there are robocalls out there, the one that has a little beep in between. I always tell my clients, when you hear that beep, just hang up. okay? Or if they talk with them, just say, I have an agent, just hang up, okay? So here are just a few tips on what to look out for. Always never give your Medicare card, Medicare number, Social Security card, or Social Security number to anyone on the phone unless you initiated the call. If you called your local agent or any agency, then you should feel comfortable giving that information. Then sometimes you may want to even not do it then. Remember, Medicare does not call you uninvited, okay? They don't ask you for personal information. They don't ask for private information. Also, do not accept any money, any gifts. We all love gifts. Do not accept anything in exchange for free medical care, including Medicare. Don't allow anyone except your doctor or other Medicare professionals or providers review your medical records or recommend services, and by no means give out your Medicare number over the phone. Never join one over the phone unless you called, okay? And then if someone asks for your information and they ask for money, then you know right straight away that it is a scam call. I recently actually had two clients who were uh, part of the Medicare scam, and basically, when they were enrolled into these new plans, they were enrolled in plans that they weren't qualified for. They were enrolled in dual eligible plans, and neither one of them were dual eligible. So there are some really, really unsavory agents out there who will call you and they will tell you all the good stuff, but not the bad stuff. And also, do not get hung up on all of these large dollar amounts of over the counter, these cards that they give you. Look at the whole picture before you actually do anything about your Medicare plan. Because, like I said, these two clients of mine, neither one were on Medicaid, but they were put on a dual eligible plan, which worsened their situation. So you have to be very careful, be very diligent in looking at the whole picture rather than what sounds good.
Thank you. No, those were some great tips there. And want you all to think of any more tips, and we'll come back to the insurance options and choosing insurance plans
Okay.
in a
Okay.
bit. So all three of you, Dr. Clark, Ms. Mills, Ms. Bentley, can think
Okay.
about other tips you have for our older adults and for their caregivers as well. That'll be
Okay.
Yeah.
wonderful.
Okay.
So I'll turn now to Mr. Kilgore, who's a financial advisor, but also does a lot with living wills. So we'll start there. What is a living will? What does that mean?
Well, a living will is just a document, really a statement as to the details of a person's desire regarding their health and medical treatment. And even more so with the advanced directive, because that has to do with life support. And so those documents are very important. And really, it's part of what I call the four documents that everybody needs as a senior. And of course, last will and testament, then a living will, and healthcare power of attorney, and a financial power of attorney, which I do this every day because one thing I found was after all we've been through with COVID, it really exposed how unprepared people were. As a matter of fact, it's unbelievable because, when you don't have a will and you don't have any of these documents, you're going to end up in probate court. And what that means is somebody else will decide what happens to your property as well as your health care. And so when it comes to that living will, it is needed because somebody needs to know how to do and who's going to do in terms of your medical treatment. And even more so for that advanced directive, because, one of the hard choices is if a family has to make a choice whether to stop the life support or put you on life support. And so what happens is when there's an advanced directive along with the living will, because they work together, it's easy for the hospital provider and anybody else to make that decision whether you're going to be on life support or come off. And in regards to your health treatment, medicine, CT scans, MRI, you name it, you know, when you have that document, it makes it easier for the hospital to take care of you. And as everybody knows, when you go to the hospital and they admit you, the first thing they ask you, do you have a living will and an advance directive, which is very important documents. And of course, my clients, having taking them through the whole financial spectrum. When I get to the wills and power of attorneys and those kind of things, I really, really put emphasis on it because you'd be surprised at the folks that have no plans. And, I was always taught that if you fail to make plans, then in the future, you are planning to fail. And so a lot of times things catch you by surprise. And
Right.
so it really matters how you do it. And,
Right.
and
You mentioned four documents. You already talked about two. You said a living will and advance directive. Can you slowly tell us what the four again are that you recommend everyone have? Just kind of slowly break each one down.
yes, ma'am. Of course, the first one is the last will and testament. This is where you make decisions as to where your assets will go. That includes people, businesses, churches, or colleges you may have attended. You have to have plans in place so your family will know what goes where and how. And, it includes stuff like life insurance, as well as 401k plans, 403b plans, any stocks and bonds, any kind of asset that you have. You have to put somebody or assign an executor to help distribute your property to the ones you love. And remember, the last will and testament, is carried out by probate after you die. And so when you stand in front of probate, the first thing they're going to ask you, and I have a little small list here to kind of help out, and that is, there's a whole lot of stuff you got to bring with you. Like death certificates, you will, of course, beneficiary designations, you name it. It's just a big list of stuff. And all of that takes a lot of preparation before you stand before the probate judge. So here's what gets you into probate. If you don't have a will, you are called intestate. And if you don't have the will, that's when somebody else decides. So if you have a last will and testament, that's the first step. That is wonderful. Get it done. It doesn't really cost a whole lot. And then when you have the living will, when the hospital and other medical professionals are looking at your situation and how to treat, they don't really have to call anybody and ask permission. They just go ahead and take care of you. And even more so with the advanced directive. Because, if you're terminally ill and your family has to make the decision whether to put you on life support or take you off of it, it's a hard decision, but you can tell them in advance how you want it done. And so in my office, we talk about this a lot. And to be honest with you, I don't let it go because I know what will happen if you don't have any plans, because here's what will happen. If you don't have no plans, you could be tied up in probate for months, even years. I'll give you an example. Aretha Franklin died without a will. So, they still in probate. And they're trying to decide where her money goes. And you would think somebody like her, with all those assets, you would think that she would have had it divvied out to whoever she wants or whoever she loves. But believe it or not, she didn't have one. So they're in probate now. My job as an advisor is, number one, get all the insurance right. Number two, get the documents right, the state documents right, and that's the will and the living will. And then even more important is a power of attorney. That's where you authorize somebody to handle your health care just in case you incapacitated and you cannot talk and give instructions. That really matters. And it happens a lot. And then the last document is a financial power of attorney. 1, 2, 3, 4. This is where you authorize somebody to handle your financial situation. They'll be able to write checks. They'll be able to look at retirement plans, you name it, whatever you have. It authorizes them to act on your behalf, just like the power of attorney for healthcare. You just really is giving them authorization to do what they need to do. And so that last one, the financial power of attorney, it is a legal document. And whoever you authorize, whether it's your executor of your estate, it is imperative that you have these documents done and out of the way. Of course, you have to have an attorney to do that. And so,
Okay.
Yes, ma'am.
Wonderful. No, but thank you. Thank you. I mean, that's some extremely valuable information. I know those are tough conversations. We don't always like to have them in our families, but you shared the reasons with us why we should and the importance of all of those and that they're all different types of documents. So
Yeah.
we appreciate that. We appreciate that.
You're welcome.
We come back to see if you have any other tips for us, but I wanted to swing back to Dr. Clark. Are there any other tips you see as a pharmacist when people come into the pharmacy with insurance cards or questions about insurance that you could share for our communities and families?
Yes, of course. So one website or resource that I typically like to utilize is it's on the Centers for Medicaid and Medicare Services website. It's called Coverage to Care. So on the website, it actually has multiple resources available in at least 10 different languages that kind of helps to break down explanation of benefits, understanding terminology for patients, and it also has a lot of resources that can help combat navigating fraud and abuse. So there's also a roadmap that's available. Oh, yep. So Coverage to Care is developed by the Centers for Medicaid Services as an initiative to help your patients understand what their healthcare coverage is. It helps you connect to primary care providers and as well as preventative services that are for them. So it also has roadmaps available in different languages that explains what their healthcare coverage is, how to use it to get primary care services and preventative services. So it's available in Spanish, Arabic, Chinese, Haitian, Creole, Vietnamese, and as well as tribal versions as well. So it's very all inclusive to many different patient populations, and I always try to help patients to get onto this website. There's also resources that are available that's called My Health Coverage at a Glance. And what that really is, it helps patients track what their deductibles are, what their premiums are, helps them, it's like a formatting tool to help them understand what's their co-payments for various medications or healthcare visits, what their out-of-pocket maximums are. And I feel like just having this as a tool helps patients really understand what to expect going into different appointments and what to expect so that they can also help them navigate and avoid any fraud.
Excellent. Thank you. And we'll include those tools at the end so that everyone will have access to those resources as well. Coverage to Care. And what was the second one you mentioned?
So
I
it's all on Coverage to Care, but it's on the Center for Medicaid and Medicare Services. But when you log onto the website, it has multiple tabs of different tools that you can navigate through to kind of see what you can use to help you stay on top of your new plan.
Thank you so much. And if someone comes into the pharmacy who does not have a Part D plan, how do you help them figure out, how to pay for their medications, or what tools or resources can you share with them if they don't have a prescription drug plan?
So patients that don't have prescription drug plans, there's also available online lots of resources that kind of you can enroll patients in for discounted drug costs. So usually with certain maintenance medications, there's coupons available. They can for as little to no cost, but for certain branded chronic medications that patients will be on, usually with these drug manufacturer companies, you can enroll patients in and have for patient assistance programs, and that can also help them pay for medications out of pocket for little to no cost at all. So depending on what the patient presents with and what medications they will be on. There's a lot of patient assistance programs that help enroll patients in, and then we can go from there to see what resources are available.
Awesome, awesome. Thank you. Ms. Bentley, what would you like to add to that conversation and just any tips in general? Because I know you work, especially in church settings, with a lot of our older adults. Both you and Ms. Mills are present at our health fair general conference. So what other tips do you have to share?
So in just piggybacking on top of what Dr. Clark just mentioned about individuals coming into the pharmacy without having a medication plan. So normally when we partner, I know Michelle and I will partner with individuals' pharmacies, and they would give us a call to say, okay, we have this Medicare person who only has her original Medicare, and she doesn't have a medication plan. At that point in time, Michelle and I, we would meet with that individual, take a look to see what medication plan they might be eligible for, or whether or not we can enroll them in a advantage plan, which automatically includes the medication. So that would give that person an opportunity to minimize their expenses for the medication, as in addition to what Dr. Clark also mentioned. The next thing that happens sometimes with that is we'll have individuals who has high medication expenses, right? But their income is at a point where they are eligible for what is called extra help or low income subsidy. What that does is give the individual an opportunity to be assisted by the state in paying for their medications. So that is also another avenue there. I just wanted to also go back to what Michelle was saying earlier about the tips on scams. If someone calls you on the phone and they're calling from Medicare and they're asking you information about what Medicare should already have, then that's a big red flag. Medicare is not going to call you to have you give them your information. They already have your information.
That's
Okay.
right.
That's a big thing right there. That's the absolute big thing. If you're on the phone, just so happens because some of our seniors, like Michelle says, it's been lonely for them. They don't have a lot of people that they speak to. So when someone calls, and especially if they sound like their friends, which these scammers will do, sound like they have your best interests at heart, and you start realizing that you're giving out information, you need to say at some point in time, I do not authorize you to change my plan, or I don't want to change my plan. Because they
Okay.
have to be doing a recording. And if you are on the phone and you're able to say that, and that recording is then listened to, then everyone will know that you did not give permission to be enrolled in another plan. But the best thing to do is just make sure that you're speaking to local individuals like Michelle and myself, because we take the time to sit down and educate you on the benefits that you have earned, the benefits that you're eligible for, and what is you feel is best for you. Take the time to sit down and match you with a plan that is the best thing for you going forward.
Excellent. Thank you. Thank you. Excellent summary there. And thank you for those additional tips. Very much appreciated. Ms. Mills, any closing words as well?
So first of all, well, thank you for the opportunity, to impart this education on our in our church. But just one other thing I wanted to mention too is another thing that's new for Medicare this year is the Medicare prescription payment plan.
Yep.
That is ideal for persons in the beginning of the plan year who have very expensive medications, where they can spread the cost out over 12 months. So now seniors don't have to choose between food and medicine. They can just pay on their medicines, and they'll never be turned away from getting their medicines at the pharmacy. So that is huge. That is huge. I really like that. And all you have to do is opt in at any time, and you can opt out at any time as well. And you opt in by calling your carrier, whomever that is, and they'll opt you in. And so when you go to the pharmacy, you'll never leave without your medications. I love that for 2025.
Absolutely. And
Mhm.
on top of that, you just never even have to pay for it at that point in time. Because
Exactly.
the carrier invoices you later on. So you
Exactly.
never have to go, like Michelle said, never have to go to the pharmacy and say, oh, I don't have enough money to pay for that. So
Hmm.
I can't get it. You can get your medication because you've opted into this plan.
Excellent. Thank you. Wow. I hope a lot of people will share this video that you're hearing this evening with family members, community members. Mr. Kilgore, any other words? I know, repeat those 4 documents again or other tips that you may have.
Okay. Thank you very much, and thank you for inviting me. I really appreciate it.
Thank
I'm a
you.
living Stonian. My
I
people.
know a lot of people are going to
Yeah,
be excited
yeah.
about that.
Livingstone was very good to me. Yeah, yeah. I was an athlete there, so we had a good time while we were there. But in terms of those documents, one of the things that I try to encourage is to be intentional when you're making plans for your estate, as well as all the other financial planning that goes with it. You
Hmm.
know, when you talk about financial planning, everybody knows about life insurance and health insurance and disability and retirement and all that you have to do. But you have to remember, you have to have what I call, and I wrote this down, end of life decision. And that means those 4 documents. Whatever you do, get a will done so you won't end up in probate. Because if you do, here's what happens. Listen to this. You go in and they say, well, do you have a will? No, ma'am, I don't. No, sir, I don't. Well, we're going to have to put a ad in the paper, and we can't give you access to the money or these things that your name is not on. And so what happens is they put an ad in the paper, and anybody that wants to make a claim to that estate, they can. And they wait until it's all paid off, the debt, and then you get what's left. And not only that, I know probate can be anywhere from 2 to 7% of your estate, so they're going to get paid one way or another. But a simple will could take care of it, or even a trust. So I'm just encouraging folks to be, intentional, do some planning, pick a good advisor, and if he's not talking about the whole picture, leave him alone. Go talk to somebody that knows. It needs to be somebody with at least a few years experience. I know I've been doing it 43 years, so I'm not a spring chicken.
Right.
And so, yeah. And so when I got out of Livingstone, this is what I started doing in 1981. And so
Wonderful.
these documents are very, very important. And to add, me and Michelle are partners, and so we do all of those documents through Legal Shield, which they've been around a long time.
Right.
And those 4 documents, you can get them done at no cost. All it requires is a membership. And so we do that all the time. We
Hmm.
don't really outsource it to the local attorneys because they're just too expensive.
Yep.
Those 4 documents are probably around $2,000, and most people they can't afford it.
Right.
But through our partnership with Legal Shield, we are able to do that, and don't cost them anything. So they're very happy. So my last word is just be intentional and talk to somebody that know what they're doing.
Exactly.
Excellent. Excellent.
Hmm. Hmm.
Well, this has just been wonderful. I'm so sorry we're out of time. I just really want to thank our panelists this evening just for volunteering your time, your wisdom, your expertise to all of our churches across Zion and those who are listening around the world as well. And so we just want to say thank you again so much. We have just a few closing slides, a couple of resources. If we are able to bring those back up, we'll share those 3 slides. And the first one um, is a tool, is a medication list tool that was developed by one of the partners of the health ministry of the AME Zion Church. And this is Nova Script Central by Dr. Donnie John and his team. And they developed a medication log. It's a list. And it has space for you to put your medication name, strength of medication, What type of medication is it? Is it a tablet? Is it a liquid? Is it a patch? What are you taking the medication for? A lot of times you have these medication lists, but it doesn't have a space for what is the reason. Are you taking it for your heart, for your lungs, diabetes, etc.? And then also, when and how much do you take? Do you take it in the morning or in the evening? There's a space for that. And also, which days of the week? Is it every day or just certain days of the week? What time of day? So this is an excellent resource that you'll see. It's called a medication list, developed by novascriptcentral.org. And you will see that on your screen. And we also have a flyer from Miss Bentley of an upcoming seminar that she'll be having on November 6th, a.m. to 1 p.m. Medicare, driving you nuts. And so it's an educational event, as well as information on how to reach her. And also wanted to share that both Miss Mills and Miss Bentley, both of their companies were represented at our inaugural health fair at the General Conference in July of this year in Greensboro. They were well received along with our other vendors who were present, but really they just shared their time, talked to a lot of individuals about choosing plans. They love to work with our churches as well. So please reach out to them. Their information is going to be shown here on the slides as well. So again, we want to thank you all so much for your time this evening, for tuning in. And we want to thank Darren Kent, our Chief Communications Officer, for hosting this wonderful conversation tonight.